I will take you a much longer way than you probably now expect, but I think it takes much longer than we, in part also today, talked about this way from our today reality to a new reality, including the use of AI. And so the first I want to share with you is who we are. The University Hospital in Frankfurt is a mid-sized university hospital here in the middle of Germany. We have 33 medical centers and institutes, and we treat around 46,000 inpatients and almost 500,000 outpatient cases with a CMI, which is the disease degree or the disease severity of 1.3. And the fields with specialties in our house are neuroscience, oncology, and cardiovascular. Who are we? This is the University Center for Digital Healthcare, and I will show you in some minutes why this is, from my perspective, important, that AI is a way of collaboration. We are working together in this university center from a science perspective, from the technical perspective, and from the user perspective, user, physicians, and nurses especially, because we think that all these digital solutions we now and in the future implement need all these three perspectives, especially as an academic institution. We have to take also this part into consideration, and we can learn a lot from our academic colleagues, especially about standardization, about interoperability. They take this with them into our world. They are much more already working in standards and interoperability and data exchange than we do in the clinical care and the healthcare, and we can learn a lot about. And also, if we talk about AI, we want to talk about high data quality, and this means that we standardized and valid data. So who we are, this is beside me as CMIO. From my origin, I'm a gastroenterologist. So I'm not a technician and also not an informatic. This is Professor Holger Storff, who's the head of the Institute for Medical Informatics in Frankfurt, and Jens Schulze, who's the CIO. And we founded the University Center in 2021 as the result of a long-term, very good collaboration already between these three institutions. The way from data to AI means also that you need a lot of experience, and of course you need a lot of data. So you need to be already on the way of digitization, otherwise you have paperwork and you have no data in the system on which you can learn. And we started already in 2002 with the implementation of a first health information system, which is still in work. In 2005, we already implemented a central PACS. And around 2009, we started with the first digital documentation. So we have data for more than 15 years for some of our departments already available for the inpatients. And in 2013, we started our digital documentation also in our outpatient clinic. And if I go back to the number of cases we have, the most data we have from our outpatient clinics, not from the inpatient clinics. And today we have a complete electronic documentation in-house. 2018, we started our Miracum Consortia, which is our consortia in the Medical Informatics Initiative, very important initiative of all the university hospitals in Germany for standardization to make data available, and especially to make data available for exchange. And in 2018, we started a project called Digital University Hospital Frankfurt, which combines 14 projects. It's a kind of a program with different goals, but with the intention to intensively collaborate between these projects to achieve goals like interoperability, but also availability of data, implementation of new exchange platforms to our patients, to our physician colleagues outside of the university or in hospitals and in outpatient clinics, and also to implement new, do I get it? Yeah. To implement interoperability platforms which combines our information systems like the lab system, the radiology system, and some other subsystems. And interoperability is the main goal in this initiative, so that we make available the data for different solutions. We have more than 400 applications running in parallel in the university hospital. So it is necessary to make the data more standardized, to have a bidirectional exchange, and also again to make the data available for scientific questions as well as for the AI training, for instance. And so we have now, over the past at least 5 years in all our departments, an electronic health record as central data resource. This is already an opportunity of transparency and availability of the health informations for all patients in the clinical, for the clinical purpose. But beside the clinical purpose, you know, we have different other purposes we are working to. And this is the secondary purpose, of course, the billing quality and quality management. And in the tertiary way, the tertiary purpose is the scientific question, so the research data, and of course to get these data back again as experience and as new guidelines into the healthcare. So how do we get these data now running? How do we get them available? And this is what I already talked about, the Medical Informatics Initiative. In all university hospitals in Germany, we implemented these data integration center, which were important also on the way of a German-wide standardization and identification of baseline data or base data, which are important in a broader spectrum for scientific questions, and also to learn more about data exchange between the very different heterogeneous health information systems, even between the university hospitals. And the past 5 to 6 years, we also learned in Frankfurt a lot about our own data information structure. How do we get these data? What is the data quality? How can we consolidate data? And could implement also the first AI projects. And what are our current AI projects? I have here 4 of them shown. I will talk a little bit more about the last 2. The first one, or the first 2, are especially not for training of data or for the use of clinical decision support systems, but to structure data. So the first project, DECDAT, on the left upper corner, is a project with which we try to get structured data out of scanned documents. So out of the PDFs we have from scans, we have to anticipate that in the next years we will have a lot of unstructured PDF documents we get into our systems, mainly by scan and further, and also by electronic transfer. And we have to deal with this information. highly redundant, a lot of information, always the same in the different documents for one patient. And in some of them are very important information. It's a little bit like the needle and the haystack to find out these important information. And we try with this project to get more structured information out of these scanned documents so that we can use these data better than just as a PDF. The next one, LLM for anamnesis, is a project in which we try to get structured data during the documentation so that the physician himself can already check if the AI is structuring the input correctly. So we have a learning feedback, and we have the opportunity to get the structured information already available directly after documentation. And the second line project, Saturn, and Susan, I will talk a little bit more about. Saturn is a project we are working together with the University Hospital in Dresden and also with Fraunhofer and our Institute for General Medicine. And this project has the goal to implement an internet platform in which a general practitioner can, unfortunately, currently type in the information about a patient for whom they have no idea what the diagnosis is. They have a lot of findings, but they have no idea how to deal further with this patient. And this information is then analyzed by 3 different algorithms: a rule-based algorithm, a classical machine learning, and case-based reasoning. And all 3 algorithms give an advice to a possible diagnosis with a certainty in this diagnosis. So, and also gives an advice for a further next step. For instance, an expert in this field for the suggested diagnosis, or for medical guidelines like order sets. So what can we do? What can the physician do with this patient as a next step based on guidelines? But this is a project where you have data analyzed retrospectively to train your system, and also the physician is typing in retrospectively analyzed information about his patient and push this information into the system because the physician has a question. But there are also other use cases which do not have this time. So we anticipate that AI can support us, especially in questions where we even don't have a question. We think the patient is fine. We think we know everything about the patient, and the system should push up the information and the advice that there could be a problem. And for this, we need another technique too, because we have to make the data and the algorithms in real time available in the health information system in the hospital. And for that, we are currently implementing a so-called FIRE clinical data registry. This is based on our communication server infrastructure and present relevant data for such applications in real time to the systems, and is also then able to bring back the push message to the health information system so that the physician is informed even before he has an idea that there is a problem. And for that, you need this kind of infrastructure which is different to the infrastructure like for such query models as Saturn. And how does that look like at the end? Susan, this is Susan, the use case we have is antibiotic stewardship on the ICU currently. So we are collecting the data from the ICU systems, and in the back end, we have also an alerting system showing up difficulties for the patients or upcoming complications like a pre-sepsis. So I come to the end and want to conclude. The data, at least in a number of hospitals already in Germany, are available. We can already use AI, but we have to make our data interoperable, or the data resources interoperable. And we have, of course, to work more on the data quality, because currently we are not documenting in a way which is necessary to use these systems really successful. But it was not the aim until today to do that. We had another purpose for which we documented. And what we already can do, and we have seen a lot of solutions already, is the usage of AI on retrospective data, but we have still to work on our systems to make these AI algorithms also available in a real-time manner, so that we can also get push-up messages which were generated automatically. Thank you.